Hypoxemia is a situation where there is low oxygen content in the arterial blood. And if you model the alveolus with a pulmonary capillary, and you think about the diffusion of oxygen from the alveolus across into the capillary where it binds to a red blood cell, what hypoxemia really is that you're not getting enough oxygen bound to that red blood cell so it can be transported and to allow for tissue metabolism. Now, when your patient is hypoxemic, there are generally 4 situations that you need to think about. The first one is your patient adequately breathing? In other words, hypoventilation is the first potential cause of hypoxemia. Hypoventilation occurs in situations such as the use of medicines like barbiturates or morphine. So I'll just kind of put drugs there. Hypoventilation can occur if in fact your patient has damage to their chest wall and they're not physically able to bring the air in and out. Hypoventilation can occur in diseases where something like myasthenia gravis, where there's a destruction of the acetylcholine receptors of the skeletal muscles and they can't drive the breathing pressures. Hypoventilation can occur if there's paralysis of the ventilatory muscles, spinal in upper neck injury, that sort of thing in the spinal cord. Often hypoventilation occurs in the situation of sleep apnea and is associated with obesity. So of hypoxemic stimuli, hypoventilation is the first thing one might think about, and these are just some generalized potential causes for the low level of breathing. The second thing that one might think about for hypoxemia is diffusion abnormalities. And a diffusion abnormality is a situation where there's difficulty in bringing the oxygen from the alveolus across into the pulmonary capillary because of potential thickening of the alveolar membrane, backward fluid movement across the alveolar capillary where water develops in the extravascular space, that sort of thing. Number 3 is a shunt, and a shunt is when blood flow bypasses the ventilatory unit. It bypasses the alveolus, so there's no proximity there for diffusion to even occur. And then last but not least is, or are, ventilation, V.E, perfusion inequities. And this is a mismatch between the blood flow and the ventilation. So what we'll do in the next section is we'll take and talk specifically about diffusion. Then the following section we'll talk about shunt, and the section after that we'll talk about ventilation perfusion abnormalities.